Hello, my name is Mark Valderrama, and today I'm going to be performing the administering oxygen therapy video. Okay, so before we start, we're going to gather our supplies. We have our hand sanitizer, gauze, nasal cannula, a pair of clean gloves, and our model and our non-rebuttable mask. Okay. So first, we're going to enter the patient's room. We're going to open the door or curtains. Alright, so we're going to close the curtains on the door to provide privacy for the patient. And after that, we're going to introduce ourselves and confirm that to identify. Okay. Hi, my name is Mark, and I'll be your nurse for today. May I get your name and date of birth, please? Alright, confirm that through her wristband. Okay. Hi, Miss Smith. Alright, as for today, we're going to be administering or applying oxygen for you as per doctor's order or provider's order because your oxygen level is pretty low and we're going to apply oxygen in here, okay? Do you have any questions? No questions? Okay. So first, we're going to perform hand hygiene, either applying hand sanitizer or washing our hands, okay? After that, we're gonna put on our pair of clean gloves. Alright. Alright, Ms. Smith. So we're just gonna put a nasal cannula on you. So the normal range for a nasal cannula are 1 to 6 liters of oxygen. Okay, so as per doctor's order, you're only going to be getting 4 liters. Okay, alright, there we go. And we're going to attach this to the wall for the oxygen, designated oxygen levels. Alright, there we go. Just going to open this up. Let's clean it up. Sorry about that. There we go. This one. Alright, I'm just gonna adjust this so I can fit you nice and slow. Under the chin. There you go. So to prevent any skin irritation, we're gonna apply some gauze at the cheek and behind the ears of the patient. Okay. So we're just gonna apply gauze on you so you don't get any skin irritation, okay? There you go. Excuse me. There you go. Alright, Ms. Smith. So I'm gonna come back every 2 to 4 hours to check on you and see if your oxygen level has improved, okay? Alright, so after that I'm gonna take off my gloves, perform hand hygiene, and come back. Alright. I'm gonna come back to the patient. Alright, Ms. Smith. It seems like your oxygen level hasn't improved, so we're gonna find an alternative, which is applying non-rebuttable mask as per doctor's order, okay? Alright, so we're just gonna first remove the gauze. Okay. And throw that to the right receptacle. There we go. And this, oops, it's alright. And that. We're just gonna throw this in the right receptacle, okay? There you go. So we have our non-repeatable mask, and the normal amount of oxygen for this is 10 to 15 liters, and for the doctor's orders, you're only gonna get 12 liters, okay? Alright. So we're just gonna get tubing, and we're gonna attach this to the designated oxygen placement, okay? There you go. Just gonna put this on. Sorry about that. Excuse me. I'm just gonna tighten this up to fit in and nice and snug. There you go. So just to let you know, the bag may not inflate, however, it will still circulate oxygen, okay? Alright, so after that, to prevent skin irritation as well, we're gonna apply some gauze on you. So right here on your cheek, and behind your ear. Go. So as per usual, I'm gonna check on you every 2 to 4 hours and see if your oxygen level has improved. Okay? So we're gonna remove our mask and perform hand hygiene and then come back. Alright. So I come back. I'm gonna check on the patient and alright, Ms. Smith, so it seems like your oxygen level has improved and I'm gonna be removing your mask now and go from there, okay? There we go, remove this from the gauze. Alright, so I'm going to throw that to the right receptacle and remove your mask. And then we're going to throw it to the right receptacle. Okay, we're going to remove our gloves. And throw it to the right receptacle and perform hand hygiene. Okay, Ms. Smith, and for today we're done with your therapy, okay? So after that, I'm gonna go out the room and document my therapy, okay? All right, thank you.